Hello, everyone, and welcome to today's webinar on billing in Manitoba. My name is Vicki, and I've been with QHR for 11 years, with the most recent years as a product trainer. As part of the training team, I teach clients core Accuro workflows, as well as billing training in all provinces. I would like to point out a few items for our live event today. As always, our training team is ready to answer your questions, so be sure to use the Q&A button at the top of your screen. When you click on that, you'll see that the question and answer pane can open on the right hand of your screen, and then you would just click on the Ask a Question button to submit a question that you may have. Click on New Posts will allow you to see any newly posted questions and responses, and if you've asked a question, once it's been answered by the training team, you'll see it show one comment under that question. Click on that to open the conversation and see the reply. Please enjoy today's event. Although it is live, the presentation is being recorded and will be available in the Accuro Resources page should you need to review anything in future. Not sure where that is? Stick around and I'll show you how to find it. All right, so for today, we're going to go over basic billing information. First will be commonly used provider configuration and user credentials. We're also going to look at how claims are created, a brief example of hospital billing. We'll also touch on submissions and downloads. And then we're also going to go over how to manage your returned claims, including claim matching and checking your accounts receivable. All right, I'll also sprinkle some tips and tricks along the way. So let's get started. The first thing that we're going to go to is provider configuration. Now to get there, I can press F2 on my keyboard, or I can click the Accuro menu. Helpful tip. When you open the Accuro menu, it defaults to the search field, but you can also use the menu item. When you want to use a submenu, just click on that menu header to open it up. And if there are any shortcut keys on your keyboard, they're going to be listed on the right-hand side. So as mentioned, we're just going to go to Configure Providers or F2. In this window, it's going to load all of the office providers on the left-hand side. And when I need to make any edits, I'm going to click the provider if they're not already loaded, and then I'm going to click the Configure button down here at the bottom. Now, the next thing I'm going to do is go over to the billing options screen. I'm going to get there by clicking this next button at the bottom right so that it loads for me. If you click in here and you have it grayed out and you're not able to make any edits, please contact your office administrator or our client services team for help. So basics that we would want to go over and make sure that are configured for our physicians are practitioner numbers, specialty, and adding those is going to be done with the Add button on either space. If it's a provider that works in hospitals, we want to make sure that we're adding facilities where we can edit or add a code. And then we also want to be, let's do that one more time. There we go. And then hospital codes, again, we would use the Add button, and then we can select a hospital and click OK. A couple other things that we would want to quickly take a particular attention to is location. So if you are in any rural or outside areas, you're going to want to make sure that you're choosing that to show the location where you'll be seeing your patients. And then location indicator, again, if it's a provider that works in a hospital, you're going to want to select that. We already have enabled this patient's referring physician. So what that will do is if that's already part of the patient demographic, when a bill or an appointment is created, it will auto pull that information straight into the claim for you. And then this patient's last diagnostic code, we always recommend that if you would use this at least 50% of the time to turn it on. And what this setting will do is once you've billed a diagnostic code for a patient, the next time you create an appointment or a bill, that pre-billed diagnostic code will then pre-populate in their own future claims. Now to save our changes, the next thing we're going to do is advance through Next until our Finish button is clickable. And then when we click Finish, it will save our changes. All right, so there is also another configuration that needs to be done for anybody who's going to be doing submissions, and that's a user configuration. So again, I'm going to click on the Accuro menu. I'm going to go to File and User Preferences. In my user preference screen, I'm going to go over to my logins and use the add button to add the login that I need. And in this case, it is the user site key. I can choose which office or offices, and then I can enter in my information. So I'm going to enter in my 5-digit site number. And then I'm also going to enter in a site key. Now this will need to be done for each person who's going to be doing submissions. And then once I'm done, I'm just going to click OK. And then my next step, of course, anytime I'm changing a user preference, is to hit the Apply button at the bottom right corner to save those changes. And then I can click OK or red X to close the window. If you are making large changes, another helpful tip, make sure when you're logging out, you use the Logout button, either in your quick action buttons or the Accuro menu logout, so that it pushes those changes to your cloud profile. If you find that you've made changes and then you close Accuro and those changes haven't been saved, that's probably the step that you missed. All right, so claim information. How are claims created? There's 2 ways in Accuro that they are created. One is, of course, scheduling an appointment. It gets that process started for you. And then the other is through new bill, so billing for items that aren't added to your scheduler. How do we access them? We can access through the scheduler by right-clicking on an appointment and then going to the claim details. We can also go in through the EMR. So if you're wanting to complete a patient visit, we can go through EMR and either do day sheet by right-clicking and going view bill, or through the encounter notes, where we can right-click and go into the claim details. Or if we're doing up a note, we can always go into the note as well, and then click on the Open Claim Details button. You can also access this through the claim section by right-clicking and using claim details, or double-clicking the patient's name and opening up the window. Once we have our window open, there's a few things to take note of. We're going to have our patient information at the top left corner. And if I need to make any edits, I can click on the patient demographic button and have that window load for me. On the right-hand side, we're going to see the date of service and the provider. These are grayed out because it is associated to an appointment. And we'll look at in a minute what it looks like when we're doing a new bill. Underneath here, you would have a WCB number if applicable. Hospital date can be entered on this right-hand side, and so can the referring practitioner. If you want to use the search, you can click on the ellipses button and open up the provider search window. If you need to edit remarks, so really common when you're doing things like prescriptions, you can click the edit remarks, and then you can click on something that you've added to your drop-down if you need to, or add to that list by using Manage and adding a new one. Next, we're going to make sure that we add in our procedure code. Prefixes usually will change on their own dependent on the specialty entered for the provider, so you can feel free to just enter in the procedure code. Oh, sorry, entered in the wrong one. Oh, sorry. There we go. And then the diagnostic code if we need to enter something different. I think I've entered in the wrong. Nope. Oh, I'm re-hitting twice. Sorry about that. All right, so if I enter something wrong, Accuro obviously has me covered. So then next I'm going to enter in that diagnostic code, and then I can just tab over. It is just not liking my... There we go. There we go. Oop. All right, so once we enter that in, if we tab across, we can see that hospital is in here. Again, if I'm billing for hospital, I can double click into the space and select from those ones that we entered earlier. Also, location indicator. If we have a provider working in hospital, we can make those edits. Right now, I don't need those entered. And then I have the amount as well. I can add or make edits to different things in my bill details tab here by either selecting a different practitioner number if needed, specialty if the doctor had more than one, location we can see was already preset from what we chose in that provider configuration earlier. internal notes are anything that I want to add about this specific appointment. And then it just stays within the claim, so it doesn't get submitted like the edit remarks would. Before we close out this window, I do want to bring attention to the start and end times. Those are going to be indicated by the start and end time of an appointment. If you're doing new bill, it would be a preset option on when you wanted that to be set for. If you need to submit claims that require start and end times, those will go with the claim. But if you're billing something that doesn't necessarily require it, you would want to come up to claim indicators and use this include start and end times. Once you do that, then the start and end times would be added to the claim during the submission process. So I'm just going to cancel out of this one. So now, once I'm done my billing, I can go on to my next patient. If I'm in the EMR, I can come up to the drop down here and then go on. This is another little helpful tip for the day sheet that I have selected. So if I come into here and I have my date, when I come into the encounter notes, this drop down is also my day sheet. So I don't have to jump back and forth. I can just stay in this window. When I want to do a new bill, I have a variety of places where I can do that. I could use a quick action button. I can do that through the EMR, and I can also right click and use new bill. But I can also use Control B. So for those of you who like to use keyboarding, you can come in here and use your new bill with Control B. Helpful tip, if I had a patient already loaded, I could hit enter twice and load that patient into here without having to do the search, but it's a different patient. So I'm going to use my search button in order to find my patient. Once I have my patient loaded, you'll note that now this has become clickable here for the date of service and the provider. So for my date of service, I want to make sure that I'm entering information. And I'm going to do just a quick little hospital entry. So the first thing that I'm going to do is I'm going to enter in the date that I want for my patient. So this is going to be the first date that the provider saw the patient. If I want to add additional dates, I can come into this little calendar here and click on that and enter in a date range by using the add button. And then once I enter in the date range, so I'm just going to go from the 14th and then to the last date that the provider saw the patient. And then I'm going to click OK. And that's going to give me a list of all the dates in between there. Any dates where I'm not billing for this patient, I'm just going to click on it and remove them. And then once I'm done, I'm going to click OK. You'll notice now at the top on the right-hand side, it's going to show me the number of claims I'm creating for this particular patient. If I need to add a hospital date, I can do that. But first, I'm going to want to enter in the procedure code. So once I put the procedure code in, I'm also going to then add my diagnostic. And then from there, you can see with this new bill, it pre-starts for the setting for myself at noon, but I can make whatever changes I need to. You'll also notice at the top now my hospital date has entered, or becomes clickable rather, and I can enter in the date. It does pre-select the first date that I have selected as my date of service. If this needs to be earlier, then I can always change that. Referred by, so that setting we already had preset. It's already pulled in the referring practitioner that I have for this patient entered in their patient demographic. And then from here, I can move on to the next things that I might need to add. So when I want to save, I'm just going to go save and close. It's going to give me a pop-up telling me how many copies it's making of the one I've created. So that's going to be a total of 5. And if I want to continue, I can press yes. If I don't want to, I could press no, and then I could continue editing. But in this case, we're just going to say yes. So now what I'm going to do is go to my unsubmitted claims. I would be able to see these claims in the daily claims section if I go to the particular dates. Daily claims, of course, is always going to be where the record is kept for all of my claims that have been billed for the dates or date ranges that I've chosen. But unsubmitted is where we tell people to submit from. And the reason for that is it's going to hold any claim from any date of service so that I know what I still need to submit. Once I successfully submit my claims, I'm only left with the things that I need to work on. So here I can see all of my billing for my patient. If I need to add to a particular claim, I can always do that by right-clicking and either choosing New Procedure or Control P on my keyboard to add an additional line. I don't need to open up the claim necessarily to make additions, but if I do need to, I can always just double-click and add the line using that Add button inside. This is just a little faster shortcut. Here I can add what I'm going to be billing. There we go. And then I can just tab over. And now I've added to that. I know that this is a sub-procedure because when I look at the procedure code and sub-procedure colors down at the bottom left corner, sub-procedures are that different color that I can see here when I click away. If I ever need to change these, I can always click into the square to get the color swatches and make the changes. All right, so very simplified, I know. If you have any questions about needing additional help on this, I'm going to show you resources later that you can always look at. So I just want to quickly touch on submission and download best practices. When my claims are completed, I want to make sure that I'm doing my submission again from the unsubmitted. Unsubmitted is used for a variety of things or posts a variety of things, not just your daily claims, but anything, as I mentioned, from any date. It also will contain any claims that I correct in my not reconciled, so I can submit from just one place instead of multiple places if I don't need to or want to. I want to make sure that when I am submitting from my unsubmitted, I am using the correct provider in my dropdown or every provider that I need to submit for. I also, before I press the submit claims, want to make sure that all my claims are ready to go. So I can use this little green check mark beside submit claims to check the claims and produce a list of anything that's going to be withheld when I do my submission. This gives me the opportunity to make any changes or fixes that I need in order to get everything to go. Once I do my submission, I'm going to press the submit claims button and I'm going to get my information from my user site details. It's going to add information about like the site number, the site name, and then I can choose my submission for the Epics portal or eClaims. Right now we have all transitioned probably at this point to the eClaims portal, so that would be my selection. And then I can choose to submit to MHSC, but if any of my claims were MBC insured, then that would also be something I could click on and submit separately. Because this is a test database, obviously I can't do that, so I'm just going to hit the cancel button. The next thing that would happen once I hit the submit button is that I would get a pop-up window with the file exchange control report. I don't have a copy of that with it being a test environment, but what it would do is it would provide information of what that would look like. So the number of claims, your site number, all of that kind of fine detail. If there's any kind of issue with me being able to do my submission, and there's an error of some sort, I will get a pop-up window that will tell me that I don't have access or it's a duplicate submission or whatever the error is. And each time I do my submission, best practice is to make sure that I'm clicking the remittances button in order to do my download. Once I do the download, it's going to bring back all of the reply information for my claims and update the statuses. So now I'm theoretically done my download. We're going to look at how to manage my returned claims. The first thing that I'm going to want to do always is come into my unmatched remittances. The reason for that is I want to make sure I'm tidying this up so that all of my claims have the most recent information on their pay state. Claims end up in here for a variety of reasons. Accuro is going to take care of you. If it can't confidently match this to a claim in Accuro, it's going to just hold it in here and allow you to decide what happens with the claim. I want to make sure that I'm going to have this show all service dates at the bottom selected so that I'm not needing to use the payment periods to click through and find anything. I want an accumulation of everything that I could possibly find. Another helpful feature is the show entire claim. That's going to help me see all of the information that I need for a claim when I click on a response at the top. Once I click on a response, Accuro is going to show me what it thinks is the appropriate match. Of course, I'm going to use some discernment to make sure that the patient name, their health card number, and the date of service matches. as well as the tariff codes, although sometimes these might be a little bit different. One of the biggest reasons why you're going to find claims in here is because you've submitted from a different database, and so it's just sent back as a response under the provider's billing number. Another option would be if something had been changed in the claim. So maybe it got submitted and somehow something got changed. MHSC has changed something about the claim. Maybe they paid a different tariff or something. It may come back into here. So you always want to make sure that you're cleaning this up. Again, when I click on this, it's going to give me information of what it thinks is a potential match. That being said, if I were to have clicked on that and nothing shows up down here, I can use select patient in order to do a search and find a patient based on their health card number and then try to match that way. When I have a claim, what I'm going to do is match the corresponding active claim in Accuro. So I've clicked the response at the top, active claim at the bottom, and then I'm just going to go down here to the match button and I'm going to link those together. That's going to remove it from my unmatched. Once they're linked, they'll start reporting in their appropriate remittance. And if they've come back with any kind of exposal or disposal code, it's going to show up in the not reconciled. Now, if I have claims that have come in that don't have a match, I can mark them as not on file. Not on file means that this is not going to be reconciled in this database. And once I mark it as such with either using the checkbox or by right-clicking, I can then have it removed by removing the Show Not on File Remittances. If I need to see it, again, I can turn that back on. And if I need this to become active, I can remove this Not on File designation. Or right-click again and unmark as NOF. Once I do that, then I can find the appropriate claim. As you can see down here, Accuro has brought up a bunch of options. So again, you would use discernment to make sure that the date and tariff always match. Now, the reason why I want to do this first is that when something comes back with a disposal code, if I've already cleaned my not reconciled and then I do this later, I have to go back now to my not reconciled and I'm going to have to clean up whatever it is that I just matched. So it's a way to be a little more efficient if you start with your unmatched. All right, so in the not reconciled, there are a few different workflows that I can use from here. Now, one of them, of course, is always going to be that I want to correct something in my claim and resubmit. When I do that, I can go into the claim details or again, double click on the patient's name, and then I can make whatever edits I need to. Do keep in mind that when I talk about editing and resubmitting claims, I'm talking about very basic data. It's going to be usually things that have not been paid. So I could come in and change the procedure code if I needed to, mark the claim for resubmission, and then do save and close. Or if there's something about the claim that I really didn't need to change, perhaps some patient information like their health card number, once it's updated, I can always right-click and use the resubmit checkbox. Another thing that I can do is if a claim has come in and I want to see the full explanation, I can always right-click and go into the claim history. This is going to show me the back and forth information of what's happened with the claim. If I need to, I can always use adjust to paid. So right-click option and adjust to paid in order to adjust a claim. This is used when I understand or agree with a disposal code or explanation that they've given me when they've assessed my claim. Adjust to paid will reconcile the bill. And not only will it do that, but once I choose that, I can type in a reason why this has been changed, or I can click on my drop-down and use manage. From here, I'm just going to add, and then I'm going to add my adjustment reason, and then OK. And now I can always use the drop-down for anything in future. If I need to see that information again for a reference, I can always go into the patient's F4 window or that patient appointment view button at the top. There we go. And I can always right-click on the appointment and I can look at the history. There we go. So claim history is always going to show me that, yes, this has been adjusted, and then my reason for adjustment. Now, another workflow that you would use in Accuro is write-off. So the difference between the two, as I mentioned earlier, if you agree with the disposal code, what you'll end up doing is just doing an adjustment to clear the claim out. You know you're not going to search or try to get the remaining balance owed. But if it's something where there has been no reason or explanation for why things are not being paid, you want to use write-off. That's also a right-click option here. That's used when you truly are losing income. So maybe you have a patient who didn't have coverage and you want to track that loss. When you use write-off, what it will do is still pop up that reason window. Again, you could create your own reasons. And then once you click OK, it works very much the same as using an adjustment. Because it's a test database, I don't have an example of that right now. But what it will allow me to do is if I write it off, not only will it reconcile the claim, but it tracks that lost income in a write-off report. All right, so the last little stop that we're going to make here is the accounts receivable tab. It's really important to make sure that you're checking this at least monthly to make sure that there isn't anything in here that is a surprise. So accounts receivable, we can always come up and choose an insurer type or group. Third-party insurers will be all entered insurers that your office has entered, including patient pay. Government insurers, of course, would be MCB, MHSC, and WCB as seen here. Or we can just click on a specific insurer. We can choose to include anything overpaid or to hide any invoice bills. Using hide invoice bills is usually used when you're trying to look for things in third-party or privately insured claims that haven't been invoiced yet. And then we want to make sure we press Find Claims. Now, Find Claims will run the query. It's a query-based tab, and it will produce for us anything that is outstanding. The best way to manage this is to sort by submitted date so that the most recently submitted claims are at the bottom. And what this does is it sorts it in order of urgency. Anything not submitted would be at the top of the list, immediately followed by the oldest submission date. This way we know what really needs to have our attention. We can also give a visual clue to the things that we want to see by using our color coding down at the bottom. Usually for anything less than 60 days, you don't need a visual cue, but anything over 60 days, you can add some color. Same thing with anything over 90 days. And then anything over 120 days. Then you can see how this lights up and we know the things that we really need to pay attention to. Okay, so that's the only things that I wanted to show you for our little brief overview. The last item is reporting. So if I click on the Accuro menu, I can go to Reports and then Reports or Control R, and that will bring up our reporting window. Now, earlier I had mentioned being able to do NOF. There is a report for that if you're looking for anything that you've put as not on file. And same thing with our write-off reports. If I want to come and find anything that I've written off, I have the option to go and search for those. That way, if I need to run any reports of the items that I have dismissed or reconciled, I can certainly bring up the totals for those. All right, so before we go on to the resources page, I just want to remind you that there's going to be a short survey at the end of our webinar today. We do appreciate you attending and would love your feedback, so please take a few minutes to give us your input. From here, what I'm going to do is I'm just going to move on over to how to find our resources. So if you type in Accuro EMR /support and press enter, you're going to come to our resources page. There are so many things in here that you can use for help and assistance. You can search for items. You can also go by category. If we scroll down, we can see that there's the Accuro user guide, and there's also the handy Explore training options. In Explore training options, there are great features in here. So Accuro Performance Training and Accuro Learning Academy, both of these are free. All you need to do is create a profile. Once you do, I'm just going to load what mine looks like. You can come in and search for Manitoba billing and get all sorts of resources on Manitoba billing information. Or what you can also do is go to this Accuro Performance Training option. And once you're in there, when we scroll down, you can choose that you want to look at any items that we have on for learning. Right now, I'm just going to choose Claim Basics. And then from here, I can click on the province that I need and start my learning path. If you want something more than just the basics here, there's also the option for expert-led training. When you click on that, it will take you to additional information, including our course catalog, where you can hire one of the personal trainers for expert-led training one-on-one. And then lastly is webinars. If we go into our webinar library, this is where I mentioned earlier, you're going to find the recording for today. So if you come into here, you can register for anything that's up and coming, or look at any of the stuff that we've already put on for you. I hope this has helped everybody at least gain a little bit of something. If not, then help with resources and where to find data is always going to be something that you can work with. Thank you all so much for coming, and have a great day.